Good evening, guys. This is fourth day of our 1 month chemotherapy course. So, previous classes we have discussed about general oncology concepts, oncogenesis. We have discussed about oncogenes and tumor suppressor genes and their roles and responsibilities, and we have also discussed certain pathological conditions of oncogenesis and neoplastic cell division. So, in today's class, let us try to learn about anti-neoplastic drugs. We will start the pharmacology of anti-cancer drugs. Anti-cancer drugs. So let's begin the session for today's class. So this is the fourth day of our 30-day course. So we are starting with the pharmacology of anti-cancer drugs. So let's begin the session. So anti-cancer drugs. See, in anti-cancer drugs, if we see, there are majorly six classes of anti-cancer drugs, starting from alkylating agents. These alkylating agents are those agents which will cause covalent bond to the DNA moiety, DNA base pairs, and with that they causes alkylation, and with that they causes uh, DNA. I mean, they will decrease or they will inhibit DNA replication, and with that they causes cell death. So, in anti-cancer drugs, first very important class is alkylating agents. Alkylating agents are very important, and these are the older drugs, older and effective drugs. I will try to explain about these alkylating agents in next slides. And next we have anti-metabolites. We have platinum-containing compounds, and we also have natural products in that zinc alkaloids, epidophylotoxins, taxanes, antibiotics. We have camptothecans, we have enzymes, and in miscellaneous anti-cancer drugs we have hydroxyurea and imatinib. And finally, major class of anti-neoplastic drugs, anti-cancer drugs are hormones and hormone antagonists. So these are very important. And along with this, in hormones we have immunomodulating agents also. So these are major anti-cancer drugs. So in today's class, let us try to discuss about alkylating agents. In alkylating agents, if we see, we have different classes of drugs again. Alkylating agents are further classified into different agents. In that, first one is nitrogen mustards. These are very, very important drugs. So nitrogen mustards are the older drugs, very effective, and these are cytotoxic. So in nitrogen mustards, we have mechloroethamine, we have cyclophosphamide, ifosfamide, melphalan, and chlorambucil. And next we have alkyl sulfonates. In alkyl sulfonates, busulfan is best example. And next we have nitrosurias. In nitrosurias, carbamazepine and lomustine are good examples. And the fourth alkylating agent is triazine. In triazine, we have dacarbazine, very, very important compound. And fifth compound, we have ethylenimines, and finally, we have methyl hydrazines. Okay, so these are different examples, different subclasses of alkylating agents. In alkylating agents, we have further six subclasses. So now let us try to discuss about nitrogen mustards. As I was telling you, in nitrogen mustards, see, let me explain about nitrogen mustards in detail. Nitrogen mustards. In nitrogen mustards, we have mechloroethamine, we have cyclophosphamide, we have ifosfamide, we have melphalan, and chlorambucil. Chlorambucil. So these are different examples of nitrogen mustards. Now let me tell you some important points about nitrogen mustard. See, There is nothing to do with mustard seeds. Okay, mustard seeds and nitrogen mustards, there is no relation. Actually, mustards, we have special kind of mustard oil and mustard seeds which is used as carminant in Indian kitchens. Okay, so there is nothing to do with these mustards and nitrogen. Simply they are named as nitrogen mustards. Okay, don't think that these nitrogen mustards are obtained from mustard seeds. So that is wrong. Anyways, now you see. See, in alkylating agents, nitrogen mustards are one example of classes of drugs, right? See, these alkylating agents, when we discuss about alkylating agents, first very important point, they are oldest among all anti-cancer drugs and they are very effective. And along with this, you see, for the first time, actually, these nitrogen mustards and these alkylating agents was initially used in World War One. World War One. In World War One, actually, there is a compound called mustard gas. Mustard gas. This mustard gas was sprayed. It was sprayed on the soldiers to kill the soldiers. When mustard gas was exposed, when soldiers were exposed to this mustard gas in the war field, the soldiers were having certain pharmacological action. In those soldiers, their bone marrow was suppressed, and along with that, patients' lymph nodes were compressed or suppressed. With that, most patients were dead. And these two are very important actions. So initially, when mustard gas was used on the soldiers in World War, they were having these particular actions like bone marrow was suppressed. When bone marrow was suppressed, patient is having thrombocytopenia, patient has leukopenia, patient has pancytopenia, patient has anemia, and patient died. So at that time in 1940s, Goodman and Gilman both they studied about these mustard substances, I mean this mustard gas, and they found that nitrogen mustards are certain compounds which are having cytotoxic property, and this cytotoxic property can be used for certain cancers. And from then, these nitrogen mustards, the alkylating agents, were very commonly used for different cancer conditions. Okay, so now let us try to discuss about these nitrogen mustards, alkylating agents. Now, before that, let me tell you the mechanism of action of all alkylating agents. The common mechanism of action of alkylating agents. See, one thing very important: alkylating agents. These alkylating agents are not cell specific. They have no action on the cell cycle. So that's why they are not cell specific drugs, and they are highly cytotoxic. They are mutagenic because they further can cause mutations. They are having teratogenicity. They can cause carcinogenicity. Because of carcinogenicity, they are called carcinogenic. They are having carcinogenic property. And finally, they are having bone marrow suppression. With that, this causes pancytopenia, and it also suppresses immune system. So these are different actions of alkylating agents. Very important. Most of the alkylating agents are cytotoxic, they are mutagenic, they are teratogenic, they are carcinogenic, and they are having bone marrow suppressive action. And when alkylating agent is ingested or when it is administered to the patient, they will generate some metabolic compounds, active compounds, which are called alkyl groups. Alkyl groups. These alkyl groups will go and they will bind on the DNA basis, and they binds on the DNA basis and they causes alkylation. And with this, when DNA is having alkylation, it will stop DNA replication. DNA replication. And when DNA replication is stopped, it will cause cell death. This is the simple mechanism of alkylating agents. I'll try to explain the mechanism of each drug. However, this is the basic mechanism of action of all alkylating agents. Now you see, this is one of the example prototype of alkylating agent. When alkylating agent is ingested into the body, first mechanism or first step, what happens is it will be activated. Actually, most of the drugs are pro-drugs. For example, the best drug is cyclophosphamide. Cyclophosphamide. And here, if you see, when this drug is given, this drug is first, it is activated. This active alkylating agent, when it is formed, it further goes to the DNA base pairs, and what it does, this will try to bind with the specific protein. Okay, it goes and binds to the N7, N mostly because N7 of the guanine, N7 of this guanine moiety is most susceptible. N7 of this guanine moiety of this DNA is most susceptible because on this N7 molecule, the alkylating agent or the alkylating group of the drug will go and bind, and with that it forms alkylating. It forms the alkylation of DNA. So DNA alkylation occurs when the alkyl group goes and binds on the DNA. It forms alkylating DNA, and this DNA further stops DNA replication. DNA replication, and further it will cause death of the. It causes death of the susceptible neoplastic cell. So this is the mechanism of alkylating agent. Now, if you see the specific drug about cyclophosphamide, let us try to discuss about cyclophosphamide in detail because cyclophosphamide is very important drug. Cyclophosphamide is available in tablet form. This is the basic structure of cyclophosphamide. It is an alkylating agent. Okay, alkylating agent, and it is also available in IV form. These are the formulations, different dosage forms. Okay, so it is available as 1 gram in 5 ml vial and 500 mg in 2.5 ml vial. So this is the dose in IV. So if we see the pharmacokinetics of cyclophosphamide, when cyclophosphamide is given through either oral route or through IV route, the cyclophosphamide is absorbed rapidly from the site of ingestion or from the site of when it is given through oral route. It is distributed to all parts of the body and it enters into the liver. And in the liver, it undergoes activation and metabolism. And the metabolic waste products or metabolites are excreted through feces, very important, through feces, not through urine. Cyclophosphamide is metabolized in the liver. First of all, actually, cyclophosphamide is a prodrug. It is activated in the liver and it has many metabolites. The metabolic waste products are excreted through feces. Now, you can see here the metabolic stages, metabolic steps. First, cyclophosphamide enters into the liver, and in the liver, it is metabolized into 4-hydroxy cyclophosphamide is one metabolite, and aldophosphamide is another compound. So these are two different metabolites. This aldophosphamide and 4-hydroxy cyclophosphamide are further metabolized into inactive form and toxic metabolites, active form and inactive form. This inactive form will be excreted through feces, and here the active form of cyclophosphamide is phosphoramide mustard, very important compound. This phosphoramide mustard and acrolein. Cyclophosphamide produces two active metabolites. In that, first one is phosphoramide and second one is acrolein. Acrolein. Let me explain in detail. The phosphoramide, the active metabolite, this phosphoramide goes and it causes alkylation of DNA, and with that it stops the DNA replication and it causes cell death. And the second metabolite, acrolein, it is second metabolite, acrolein. This acrolein, it is not having cytotoxic property, but this acrolein causes cystitis. Cystitis, very important part. Cystitis. It causes bladder inflammation, and this bladder inflammation is not normal. It causes hemorrhagic hemorrhagic cystitis, very important adverse effect. Name the drug which causes hemorrhagic cystitis. In that, cyclophosphamide is the drug. Cyclophosphamide is not directly causing hemorrhagic cystitis. Cyclophosphamide is metabolized into inactive compound and active compound. In active compound, we have two forms. One is phosphoramide and one is acrolein. Phosphoramide is having cytotoxic property, and this phosphoramide will try to kill the neoplastic cells. Whereas the second active form, which is called acrolein, this acrolein will go and it causes hemorrhagic cystitis. Cystitis means bladder inflammation. Okay, so hemorrhagic through hemorrhagic cystitis it causes hematuria. Hematuria, very very important adverse effect. This is the specific adverse effect with the cyclophosphamide. Now, if you see the common adverse effects of cyclophosphamide causes major general toxicities. The general toxicities of cyclophosphamide, if you see one by one, cyclophosphamide causes bone marrow suppression. Bone marrow suppression is very very important adverse effect which is caused for most of the alkylating agents. Just now I explained. So when bone marrow is suppressed, it causes leukopenia, leukocyte will be decreased, agranulocytosis, thrombocytopenia, and aplastic anemia. Very, very important. In last class, I was explaining you aplasia. Aplasia. Aplasia means in cell division will be decreased. Inappropriate cell division, or A means absent. Absence of cell division. Simple. When cell division stops, the tissue will not be proliferated, tissue will not be differentiated, and new cells are not produced. So it causes aplastic anemia. In these patients, bleeding and infection is very common because thrombocytes are very important agents for stopping bleeding. Okay, to stop bleeding, thrombocytes are important. Here, due to bone marrow suppression, patient will have thrombocytopenia. When thrombocytes are decreased, that is called thrombocytopenia. And due to thrombocytopenia, patient will have bleeding disorder. So bleeding disorder is one very important adverse effect due to bone marrow suppression. Okay, aplastic anemia is seen. Anemia means decreased hemoglobin or decreased RBC, because RBCs are matured or RBCs are differentiated from the bone marrow. When bone marrow is suppressed, the RBC generation is stopped. That's why it is called aplastic anemia. Reduced amount of RBC or reduced amount of hemoglobin is considered anemic. So it causes anemia, and it also causes infection because all WBCs and lymphocytes and leukocytes are absent. Because of leukopenia, patient will have risk of infection. Patient will have risk of infection. So when cyclophosphamide is given, always monitor these all conditions. Next, patient will have immunosuppression. See, immunosuppression is very similar to bone marrow suppression. In immunosuppression, especially, the T cell and B cell activation decreases, and with that, cell mediated immunity and humoral immunity. No cell mediated immunity is seen, and no humoral immunity is seen. No antibodies were produced. So, in the absence of cell mediated immunity and in the absence of antibodies, patient will have high risk of opportunistic infections. Patient will have fungal infection, bacterial infection, viral infection, and some parasites also can attack to the patient. Why? Because patient is having immunosuppression. Why? Patient is decreasing cell mediated immunity, and also patient is decreasing antibody production. This cell mediated immunity and antibody production is seen through T cell and B cells. Okay, T cells and B cells are the main immune cells which are synthesized from the bone marrow. Okay, so due to immunosuppression, this T cell and B cell maturation stops, and with that, this cell mediated immunity and antibody mediated immunity will be decreased. This is another adverse effect with cyclophosphamide. Not only with cyclophosphamide, with all other alkylating agents or other neoplastic drugs also. And next, GIT. The adverse effects associated with GIT are nausea and vomiting. Very, very important. Because cyclophosphamide directly goes and triggers CTZ zone. CTZ zone in the brain, and with that, patient will cause vomiting. Patient will cause vomiting. Okay. And next, if you see, patient will have skin and hair adverse effects. Patient will have alopecia. Alopecia is loss of hair. When patient is taking cyclophosphamide, or when patient is taking alkylating agents, patient will have skin and hair disorders, like patient will have alopecia, loss of hair from the body, and this alopecia is caused particularly due to damage in the hair follicles. And immediately when these drugs are stopped taking, immediately it will be reversed. Hair regrowth can be seen. Okay, so on the hair, it damages the hair follicle and it causes alopecia, and on the skin it causes dermatitis and skin rashes. Very very important. Skin becomes rough, it causes dermatitis. Dermatitis means skin inflammation. Okay, about dermatitis we'll discuss one day. And on gonads, on sex organs, the cyclophosphamide and all other cytotoxic drugs will affect, and it stops the production of sperms in the males, and it causes infertility in it stops production of sperms and causes infertility, and in females it causes amenorrhea, and further it leads to infertility in females. There is no production of sperm, there is no production of ova. So these both, because see, cyclophosphamide is very very cytotoxic drug. Cytotoxic drug. In previous class I told there were some cells called labile cells. Labile cells are those cells which will be generating they will be having lot of proliferation. Always cell will be producing, always cell division is seen. So wherever cell division is very high in those tissues, this cyclophosphamide will go and it will stop production of those cells, because they are highly cytotoxic. That's why they causes infertility in males as well as in females. And in fetus, if you see, administration of the cytotoxic drugs like cyclophosphamide and other drugs, they will cause teratogenic effect. So if anybody is pregnant, in pregnancy, never ever prescribe any anti-neoplastic drugs or any anti-cancer drugs. Anti-cancer drugs should never be indicated. Anti-neoplastic drugs should never be indicated to the patient who is already pregnant. Okay, very very important point you have to remember. And next, there is one another adverse effect which is called hyperuricemia. Hyperuricemia is the condition where patient's uric acid will be elevated. So increased uric acid will go and accumulate in certain tissues, and it will cause gout. So gout is the condition where excess uric acid will go and accumulate in joints, and it causes joint inflammation. That is called gout. And sometimes these excess urate crystals or uric acid will go and accumulate in the kidney, and it forms kidney stones in the urinary tract. Okay, this is called hyperuricemia. So hyperuricemia can cause gout and it can cause urate stones or uric acid crystals. And this type of adverse effects can be prevented in the patient who is taking cytotoxic drugs. They can be prevented by taking a lot of water, or we have certain drugs called allopurinol and corticosteroids. Corticosteroids will decrease inflammation in the gout, and allopurinol, what it does, it will try to decrease the production of uric acid, in the body. Actually, this allopurinol is a xanthine oxidase inhibitor. When xanthine oxidase enzyme is inhibited, further production of uric acid can be stopped. So hyperuricemia is very very important adverse effect which is associated with cytotoxic drugs. And next is hypercalcemia, very very important. When it may be due to malignancy or certain anti-cancer drugs. Actually, what happens when bisphosphonates are given in patient who are taking anti-cancer drugs, calcium concentration increases in the body. And when calcium concentration increases, actually the calcium content in the cells will decrease. With that, it will cause hypercalcemia. So in this condition, bisphosphonates and corticosteroids are used. Due to elevated calcium levels in the body, it may cause calcification of certain tissues. Very, very dangerous condition. So hypercalcemia is also dangerous adverse effect which should be treated in the patient. And next we have another very important adverse effect which is called carcinogenicity. As I was telling you, most alkylating agents and nitrogen mustards, in that as we are discussing about cyclophosphamide, this drug is highly carcinogenic. Okay, so this carcinogenic ability can cause further cancer to the patient. That cancer patient who is taking cyclophosphamide anti-cancer drug can also further lead to cancer. That type of cancer is called secondary malignancy or secondary cancer. Cancer due to anti-cancer drug, that is called secondary cancer. And here cyclophosphamide can cause secondary cancer. Okay, so here to decrease that anti-cancer drugs, we can try to limit the patient's drug frequency, or drug doses can be maintained, and all other parameters we can see. Now, if you see the specific adverse drug reaction of cyclophosphamide. Cyclophosphamide, I already explained you. Cyclophosphamide specifically causes hemorrhagic cystitis. Just imagine this is a bladder, okay? This is ureter, and here we have kidneys. Here we have kidneys. See, this bladder will be inflamed. Inflamed. Inflammation of bladder. Actually, this inflammation is hemorrhagic. Hemorrhagic inflammation can be seen, and patient will urinate with blood. So blood in urine can be seen. This adverse effect is mainly caused due to cyclophosphamide. As I explained you, cyclophosphamide causes inflamed bladder, which is called hemorrhagic cystitis, and this is mainly caused due to acrolein. So acrolein, which is the active metabolite, which is produced by the cyclophosphamide, this causes hemorrhagic cystitis. So this is the specific adverse effect. Remaining drugs we will discuss in the next class. Okay. So I think I'll stop here. We'll continue the lecture tomorrow. Thank you all. We'll start the fifth day soon. Thank you all.